Hi everyone. Firstly, thank you all for joining our webinar today that will be centered around transforming engagement in healthcare. My name is Liam Doyle, product specialist here at StaffConnect, and today I am joined by Helena Reeves, Director of Helena Reeves Associates and former Director of Communications and Organizational Development at CHP Community Health Partnerships, who will be taking us through her experiences and thoughts about communications in healthcare and the best ways to engage your frontline staff. So it's estimated that there are over 2 million people employed in healthcare in the UK. To put that into context, it is the equivalent to every man, woman and child in Cardiff, Manchester, Liverpool, Sheffield and Glasgow combined. Given these numbers, it's hardly surprising that there's a huge spectrum of roles being undertaken. Back office roles, of course, exist with hundreds of thousands employed to ensure that supply chains are robust, wages are paid, facilities are managed. Equally, there are hundreds of thousands of essential frontline staff who spend the majority, if not all, of their working day untethered to a desk. Ambulance drivers, paramedics, doctors, nurses, organ and blood carriers, to name just a few. With so many employees doing so many different roles in so many different circumstances, just how do you make sure that each one gets the same access to communications, insights, guidance, support and encouragement as their other colleagues? How do you ensure that your entire workforce is united in its aims and objectives? We believe the answer lies in efficient and effective staff engagement. This is underpinned by research from Gallup, which reveals that organizations where staff are highly engaged report a 41% reduction in absenteeism, coupled with a 17% increase in productivity. But what happens when staff engagement isn't working? In the healthcare sector, this translates to negatively impact levels of patient care and the associated tragic outcomes that this can lead to. Human tragedies that could be avoided through something as rapidly implementable as staff engagement. Recent research revealed that only 14% of UK nurses are happy in their job, and that 57, well over half, are actively considering a change in profession. Whether your glass is half full or half empty, the risks and missed opportunities of ignoring staff engagement are startlingly clear. So how do you go about trying to improve this? Well, what I'll do now is pass you over to our guest today, Helena Reeves, who will take us through her experience of engagement and communications within healthcare. Helena.
Thank you, Liam, and hello to everybody. Thanks for inviting me here today. So in good old NHS style, I'm going to use a big campaign message, which is introducing yourself properly. So hello, my name is Helena Reeves, and as you can see, I've been doing this comms stuff now for about 24 years. So I've seen and experienced, I think, the sublime, probably to the ridiculous in that time. And I bet many of you on this call today will recognise, well, this project has been going on for months and we're launching next week. Sorry, didn't you know that? Oh, but we need some comms input and we need it now. Or maybe we don't need to tell people that, which generally means it's probably the key of key messages. But as you can see from the slide there, I've worked in many different types of organisations. I started off my comms career actually by helping to move a children's hospital, which meant getting the message across. Yes, it was a move, a relocation, it wasn't a close. And that meant obviously trying to get that message across to staff, not alone obviously the many stakeholders. That children's hospital had become part of a bigger NHS trust, which was a brand new thing, a new organisational thing at the time. And I remember then creating the first newsletter for staff, which feels really ironic because at CHP, I vowed to make it a newsletter-free zone. And by the way, chaps, I'm really sorry, but I'm working from home today, and I've put my puppy in another room, and if she's moaning and you hear it, I'm just going to ignore her for now, and I'll make sure I make it up to her a bit later. So apologies if you can hear any noise from my end. But not long after moving the children's hospital, which I have to say was a lot of fun, even though I felt at the time I was the photocopying queen, I managed to land the main corporate role for the trust. And literally just after 2 months there, my marketing director took me aside and said, right, and this relates to sort of the project launching next week kind of comment, but today we're going to be doing emergency briefings across the hospitals because we're going to be merging with a nearby one, and you're going to do all the comms. And you know that moment where you actually feel like you're just going to die on the spot. But I have to say, I really wish, and I really truly wish we'd had this kind of technology back then, as I think that would have made life so very much easier, myth-busting particularly. But what does really help, and I found it been enormously helpful when you're working in comms in the NHS, is actually having a clinical background. It's a really complicated setup. Because the NHS is just not a single body. It's made up of myriads of organisations. There's multiple regulators. There's intense public scrutiny. It's been having a ball recently with the NHS birthday, but that's, a once in a lifetime moment. But having that clinical background means that I can understand, I can speak clinician speak, and that means building those really good relationships much more easily. And never a bad thing when you're trying to persuade a medical nurse director that this is really the right thing to do. I set up my own company after the last political shake-up because when the NHS restructures, it's always at the whim of ministers. So I think we'll have to wait and see whether the new Secretary of State is going to be too busy Brexiteering or whether he wants to decide on another one. But we'll have to see. But a common thread, I have to say, through all of those years is that internal communications and really good staff engagement is absolutely critical to any success. Liam spoke earlier about good patient outcomes. Absolutely. If you've got unhappy staff, it's not going to go well. And I'm sure you have similar protocols in all the kinds of organisations you work in to the NHS, which is to inform staff first. But I'm also sure you've had the same battles in the past as I've had, which is a different story, getting your exec team to actually get out there and do it. So Liam, would you mind turning over to the next slide for me?
Yeah,
I think that might be coming. Thank you. So there's the same issues, I think, all the way through as now. And the next slide will talk about, what's the challenge? I think it's the same wherever you are, whether you're working in a small company like CHP, which is about, when I was there, it was about 150 staff. It's heading up to 200 now, or you're working across thousands. It's the same challenges, I think, about internal comms. I actually pitched for some work recently, and it was a really small team, only 14 people, and believe it or not, they had staff engagement issues. I just found that incredible. All in one office, still issues there. And as Liam mentioned earlier, all the research is absolutely clear. Get your guys on board, and all the, just says that they'll be happier and more productive. Get it wrong, and you've got isolated, grumpy people, and that negative energy is really infectious. And it creates a distant internal culture to the one that you're trying so hard, to be values driven and really live and breathe those values that your organisation will have worked hard to create with people, hopefully. Trouble is, we're wired to see the bad. So getting beyond that downward spiral is really, really vital. And of course, right now, it's all about instant gratification. Our everyday social experiences means our expectations are geared for right now. And any time lag just isn't acceptable. I expect you're really like me, and I want stuff now in 2 clicks, not in a hour or next week, thanks. And my last point there is really about cost savings or productivity gains, or whatever your organisation euphemistically calls that. Getting more done with less is absolutely the norm. And if you're working in the NHS, God, it's tougher every year. 4% becomes 6%, and trying to find those wins is really difficult. So, Liam, again, if you could switch over to the next slide, I want to just tell people a little bit about CHP. It's 100%, if you haven't heard of CHP, I don't blame you. It's not the world's best known story. I did try to get it out there a bit more. It's a small company. It's 100% owned by the Department of Health. And although it is a private company, it has got one foot in the public sector Liam, it's gone back to the previous slide. Thank you. Hopefully it'll come up.
Sorry, 1 second. Ooh. Some issues here. My bad.
Okay, I'll carry on talking. It's got one foot in the public sector as well. It's a really weird relationship. It's a head tenant and it's also a part shareholder in its 340 buildings, and it's also got 3 regional offices around the country. And if you could flick over to the next one, please, which means for comms, obviously there's challenges in itself. It's a national organisation. It's geographically dispersed, and there are people commuting, they're out on the road, they're in all those multiple sites, and they're not tied to desks. And that's the same for frontline staff in a NHS hospital, whether it's a community trust, it's a social enterprise serving the NHS, it's a mental health trust, you've got ambulance service, it's the same thing. People aren't tied to their desks. They had perceived really high quality internal communications when I arrived. But what was interesting, the reality was quite different. And I've put there was just one monthly internal newsletter, and believe it or not, it was in Word. I couldn't believe it. So the bottom line was that staff weren't aware of what was going on, and they were really cross, and the culture was really stuck in that email paradigm, which I'm sure is the same for you. Let me just add here that one change I did introduce was to broaden the company's innovation programme, and I made it an inclusive approach. So through that, what I did, I set up innovation challenge groups that were open to the entire organisation, and it was from that the Staff Act was discussed at the very first meeting, and from there obviously developed the business case, did the usual, got exec agreement, and went on to implement StaffConnect's app. But at the time there was no formal programme of staff involvement and engagement, but they had this amazing, and it really was, and I still don't quite understand it, apart from, think maybe it's because they've got very senior people, this amazing engagement score that I really wanted to hang on to, despite there was this all surround sound of potential merger, and of course the very natural staff fears of redundancies and of job losses. So for me, it was absolutely imperative that we found better ways. And I think the change to the innovation programme, plus, of course, use of technology to facilitate better engagement, made all the difference. And I'll talk a bit more about that later. As you can see on that slide, my single objective was to improve or maintain that high engagement score. But literally just before, and the same month, and it was only a couple of weeks, just before we were ready to launch our new app, this happened. So Liam, next slide, please. Yeah. Westminster Bridge attack. I hadn't, to be honest, at this point, included the new app, which, by the way, we called Buzz, in our crisis comms planning. So this, I have to say, was literally thinking and reacting on the spot. Very, very real issue for us because we had no idea of knowing if any of our staff were in the area. The London office is based at Elephant and Castle. Lots of people would use the opportunity to walk to the Department House offices, either at Wellington or over the bridge into Richmond House, which is opposite Downing Street. And of course, by doing so, they'd use that bridge. And you'll know that under the Civil Contingency Act, and of course in any emergency situation, the first duty is to inform and warn if appropriate, but keeping those comms channels open and active is absolutely vital. It's, when you get judged in the court of public opinion, it's not always what you did, but how you did it. But for me, as the Director of Comms and OD, we had also a very real duty of care to staff. And using Buzz, our new StaffConnect app, thought was a perfect solution to really rapidly communicate the facts out there. And incidentally, it just really helped to introduce benefits before our staff conference launch, which was at the end of that same month. And I've just chosen one post there that you can see. There were many. And we'll use the ticker tape and push notifications to get staff to just report to their line manager to say, I'm safe, I'm okay. And what I understand now is that there are better versions of the app since we introduced this version to start at CHP, and in the later versions there's messaging, and you can now target with that messaging. So that would have been icing on the cake at the time, because I could have identified people prior to the attack and zoomed in on those rather than maybe done an all staff message. But it is something I would absolutely incorporate into an integrated comms strategy today, because it would have made, I think, all the difference. But being able to get that rapid information out was just awesome. We'd never had that opportunity before, other than by email. Liam, if you could move on to the next slide, please. Just wanted to show people a little bit more positive content. A little bit, it's my machine, but it's not flipping over.
1 second. There you go.
It's okay. Right. We've been, there's a little bit more positive content here. And in this slide, I wanted to show you some of the sort of more, little bit more light-hearted than crisis stuff. Crisis stuff is really important. And let's face it, it's comms people, never waste a good crisis. It can make your name for you. These ones I've picked out here were celebrating the NHS 70th birthday, which I'm sure you can't fail to have noticed recently. And it's something I'm deeply involved in with the NHS charities. So the first one you can see is the Big 70. We've been encouraging everybody to host a NHS Big 70 and fundraise for the NHS charities who do so much to support the NHS. And you can just see some of the fab results. The team back at CHP persuaded the lift companies, whom they're part shareholders with, as I mentioned earlier, to fund tea parties in each of the buildings, and it's just incredible. There were so many posts, I have to say it was really difficult to choose just a few. And I was reminded yesterday to be careful, obviously, with GDPR and not identify individuals, so hopefully you can't see any one person's name on there, otherwise I might be in deep trouble. But the real message for this slide, as I wanted to show you, was that staff are now really active content producers, and they're not just lurking around watching what's going on. Because what you want to do is convert lurkers to fully engaged contributors. And I'm really pleased that that's now happening across the organisation, because one of the key asks by staff in those innovation challenge sessions was the ability to connect and share with colleagues from other areas. And in particular, they asked to share across functions and across offices. CHP has some staff in quite remote areas, particularly down in Cornwall. And the ability to connect, I think, both in the social and the corporate post, I think has been really much valued, and has contributed, I think, to a better feeling of engagement with the company. If we could flip to the next slide, please, Liam, that would be good. Lovely. And in this one, what I wanted to show you was just a couple of posts that are more sort of the from the comms team to demonstrate just how easy it is to give people the latest company news. These two here are obviously sort of a bit more text-based, obviously with some pictures, but what the team also do is make full use of video. And often film the chief exec instead of a written message, and Sue's message that way goes down really well with staff. They really like that. And I contacted my head of comms, I recruited her, she's still mine, the head of comms at CHP yesterday, because I just wanted to check that that external survey post implementation, because I started the survey off before my contract ended, but the results come in a few months later. And you can see, did we achieve that single objective I set, which was to maintain and improve? And you bet, and what a result. Bearing in mind, that most public sector organisations come in at circa 60, which is on that previous slide, and many other organisations come in at less than that. And you have to remember that this was all achieved against the background of potential merger. That actually did go quietly away after many, many long months. But one of the three major functional areas in CHP is transitioning out to NHS improvement, which is one of the regulators. So I think getting that all-important high has been a real major deal, and I have to say I'm really proud of introducing this kind of technology. And by the way, the engagement score is based on how staff feel about their engagement. It's not the totality of the survey, so it's particularly focused on 4 key questions about how well they feel involved in the company and those measures. So those are absolutely relating to their engagement and how they feel in the company. Liam, if we could go over to the next slide, please. And this is really to kind of sum up And I think you can tell by what I've gone through that I really believe that technology and staff engagement can be natural partners. Of course, it's not the only tool, and it shouldn't be the only tool. But I think number one for me is that ability to so easily share. And now it's that instant gratification. And I think the other important thing to remember, and it won't necessarily start at the beginning, but the important thing to remember is it's not just a top-down share, but increasingly goes upwards and across. Those departmental barriers can get busted, and you can build real relationships. And I think for me, that information sharing in real time, not a month later, not in a long newsletter that gets lost in what can be a junkyard of inboxes. Yours all might be really neat, mine isn't, I'm sorry. But it often feels like a junkyard. But it's an app for staff, and it's more and more at CHP, it's by staff. And I think that ownership drives, better engagement, a greater work happiness, and I think fosters that all-important sense of belonging, which, let's face it, is a fundamental human need. Where's your tribe? Who's your tribe? And we all have that. So thanks so much for listening. I think possibly we have a little bit more time for some questions. So I'll hand you back to Liam. Is that okay, Liam?
Yes, thank you very much, Helena, for that. That was fascinating, really going in depth, not only how you can use the tool, but kind of the effect that the tool has on the organization. Everyone kind of getting the same message at the same time. I do think it's a really useful tool for that. What we'll do now is open it up to questions, as Helena mentioned. So if you do have any questions, there should be a little questions panel that you can type them in, and we'll try to get Helena to answer those. While you're typing those in, just one or two questions from myself, actually. So sometimes I guess it is human nature for people to resist change, specifically, I guess, the cultural change that might come with a mobile staff engagement platform, I guess, like StaffConnect. Firstly, how did you go about combating this issue at CHP? And secondly, what would you, I guess, recommend to others in a similar situation?
Oh, good question. So I mentioned earlier about the innovation challenge groups that I set up. I've always been a very firm advocate, and in previous roles, particularly when I was Director of Communications at Surrey Primary Care Trust organisation, if you don't belong in the NHS, won't perhaps realise doesn't exist anymore. They all went in the last restructure. Did a lot of co-design with patients. I'm a real fan of co-designing, whether it's with staff or patients, you get a better result. And so for me, that was partly the reason why I created the Innovation Challenge Groups. Felt very strongly that any innovation programme, be it digital or otherwise, needed to, properly belong with staff, because if you're doing the job, you're the one that knows, you know how best to do it, and you know how best to fix it, and you just need to bring that out of people. And so what I did is I used, and it was interesting actually, because we did have some real resistors. I used those innovation challenge groups to get people to co-produce what the communities would look like. All those posts that I showed earlier in the NHS 71s aren't in the news section, which we decided to keep for a comms channel in itself. So only the comms people at CHP can add stuff in that in news. We've got several different types of communities. We've got communities around teams. We've got an innovation community. There's a share space one, which came out of staff saying, we want a space where we can share best practice, where we can say, I've done this. I don't think anybody else has done this in the organisation. We'll just share this because I'm really proud of it. And it's turned out to be an area where people really, really like just to share what they're doing. So it's kind of grown like Topsy, but that's an area where people really do use, and that came from them. So I didn't set the communities. I decided I would, go co-design that, co-produce it with people. So I think doing it with people absolutely works, and that's what I would absolutely recommend any organisation to do. Is don't sit there and design it just in don't put a wet towel on your head and do it in the darkened room. Go out and talk to people and do it that way.
No, I would say that's definitely good advice. Make your staff a part of the change rather than just enforcing the change on them. No, I would say that's very,
Totally, totally.
yeah. Um, Another question from us, staffing. We've actually recently published the results of our staff engagement survey, and one of the statistics that really kind of spoke out to me or stuck out was a quarter of the organisations or the those who filled the survey for us reported that their organisations have no real plan kind of set out to improve staff engagement. What would you say the risks are of this?
Um, it's that old adage, isn't it? Fail to prepare, and fail to prepare, and you prepare to fail. Um, so the very real risks are disenchanted staff, people who, your turnover churn goes up and up. Cost of recruiting is massive. Um, you staff who are in the environment, I think, suffer from a very negative internal culture. And as I said earlier, those things are really infectious, and it's really hard to overcome it. And this is one of the common things. ODs, whatever label you want to put around it. And I'm not precious about labels, but it takes a long time to overcome. And so I think if you don't have a plan, then how do you know what good looks like? How do you know when success is reached? How do you know what your staff are feeling on a day-to-day basis? I just think it's one of those. I don't understand when people don't do that. People who know me well will know that I'm a strategist. I'm a bit of a blue sky thinker, but I'm also a planner.
Yeah.
You have to get your head down and do that detail and work out how you're going to do this stuff. And it doesn't mean to say you have to have all the answers. As I said in my earlier answer to you, Liam, go out there and work out with people what they want and how that would work by all means. But not having a plan, not having a strategy, not having a clear idea about, and not using the talent of your staff is just nuts. I'm sorry, that's just crazy. Because there's more talent in your organisation than, you've got. I always say in the NHS, if you work in any part of the NHS, you've got some amazingly incredible people who save lives every day. Go use that brain. Yeah. Go use that energy. Absolutely. So I just think it's you're setting yourself up to fail, and you're setting yourself up for some big costs. And some of those are, the intangible costs that, will cost your reputation dear in terms of reputation and delivery.
Just a question from our attendees, actually, if you could be slightly brief as we're running out of time, but what are the most important things to measure when implementing a new engagement tool, and how, I guess, do you measure them?
God, blimey, that is a really hard question. The most important things to measure. So we took a very simplistic approach to start with, and I think we probably learned a lot along the way. First of all, it was really about how many people downloaded it, and then we started to look at, how many people were active, on a daily basis, what were they liking, how many comments they were making. So we got a sense of, got a real sense of, who was doing what, and also what content worked.
Yeah.
The other key thing I think for success is to ensure that for every community you have a nominated community manager, and their whole job is not to be forever the one posting and doing all the work, but their job is to nurture that community and get more people on it. And so you can also set parameters for measurement about how many, what kind of activity, what kind of activity within each community you want to see as well. So there's a number of different measures, and I think you need to work out actually what does success look like for you, for your organisation, and then there are some quite easy ways to then put in the right measures for each of those, I think.
Yeah.
Sorry, that's quite a general answer, but hopefully that helps a bit.
Perfect. I'm sure that's brilliant. Thank you. As we are, I guess, running out of time, what I'll do now is I guess I'll bring the webinar to a close. Firstly, I'd like to say a massive thank you to Helena, for joining us today. It really is amazing for us at StaffConnect to have someone with such a vast knowledge and experience in healthcare to join us. So thank you very, very much, Helena. And I would
You're
like to thank
welcome.
you all as well. What I'm going to do is put my contact details on screen there. So thank you all very much for taking time out of your Thursdays to join us. If you would like to find out more about staff engagement in healthcare or staff engagement in general, as well as finding a bit more about StaffConnect and our mobile employee engagement platform, do get in touch either by phone, email, whatever you prefer, and we can get those conversations started. After the webinar is finished, there's a very brief survey which we would be thrilled if you could fill in. It's basically just about upcoming webinars and when you would like them, which days you would prefer and stuff like that. So if you could do that, that would be amazing. Otherwise, thank you very much again for joining. Thanks, Helena, for joining us as well. And I hope you have a good rest of your day. Thanks.